The Citizens Report Card was introduced to Kenya as a way of uniting consumers' views in one strong demand for better services in the water and sanitation sector. The objectives of the Citizens Report Card were to get citizens talking directly to policymakers and service providers, to build understanding of the changes taking place in the water and sanitation sector, and to use the results of the CRC to inform dialogue for improved services for both the urban poor and the non-poor. Having been implemented in the 3 cities of Mombasa, Nairobi and Kisumu for 2 years, it was important to find out what impact the CRC process has had. Unlike many in-house market surveys, the CRC was launched at a public function to which stakeholders from different sectors were invited.
This mechanism of feedback is highly appreciated by the ministry because it gives us a chance of getting first-hand information on the services that the government is offering.
The launch of the report attracted the media, who used the data to engage public service agencies with in-depth questions that resulted in extensive media coverage, bringing the subjects to audiences across the country. The first major impact of the Citizens Report Card came from the findings of the report. Using this data, citizens were able to challenge service providers within their stakeholder groups.
The report, as we read to us on Friday, is like an eye-opener to actually know what's the exact problems encountering the communities in Mombasa. Because when you sit in the office here, you don't know what is happening down there.
For example, the Citizens Report Card found that public health officers are not visible in the community.
If they are not being felt, then they are not be there. They should not be there.
In response to the CRC findings, water and sanitation service providers developed action plans outlining how they would address the issues raised in the CRC. The action plans were crafted during the city-level consortium meetings, where public service agencies and consumer organizations came together to understand the constraints and agree on priorities.
The Likoni municipal houses, there is a lot of water and their sewerage system is so poor that some of the houses, around some of the houses, the waste is coming up.
We want to start for just the island before we move out. But that's a good notification because we shall be able now to tell that there is a needy area somewhere.
When was the last time that these bylaws were reviewed? What bylaws are we using today? I just would like to get clarification on that. I was going to ask the council if they have any communication strategy. How do we as citizens also participate in also learning what is happening in the council? How do we learn what is especially the challenges that they face in terms of capacity? And again, when we come to the solid waste management, what plans does the council have, especially on involving citizens in the management of our own solid waste?
These action plans were reviewed to monitor the progress towards the commitments made by the service providers in the 3 towns. Progress review meetings were convened every 6 months for over 2 years after the launch of the CRC. In some instances, targets set within the action plans were even exceeded.
In conjunction with Earthy Water Service Board to establish water points. I don't even want to mention the number because we are way beyond the 30 water points. We have managed to distribute up to 80 10 cubic meter tanks to 80 groups, and these have had connections made. They are either they are mainly CBOs, well-organized groups, who have taken the tanks and we have given them water points to which will be used as kiosks.
2 years after the launch, civil society organizations in Mombasa organized the action plan review meeting in the form of a public hearing to give more citizens a chance to hear from the service providers directly.
What you've spoken of here, is it in the public domain? Do I know as an individual, I have a well, I do not even know that I can actually have my well chlorinated, and then tomorrow utakuja kunishika. It's important to advertise your services clearly so that we are able to know what to do and how to do it. Mombasa is more of informal settlements. There are so many and they're coming up every other day. I would wish to know what is the plan on the informal settlements on the issues of water.
Are you aware that some of your staff members, they own the water kiosks in the town? As one. To Engineer Chihanga, the government of Kenya recently got a grant or credit from the French Development Agency and the International Development Association for the purpose of financing of the Water and Sanitation Services Improvement Program, maybe you call it the WASIP, for the coast region. But understandably, part of that money is supposed to be used to improve services in the 20 slums here in Mombasa City. And the estimated population in those 20 slums is about 190,000 inhabitants. What is the status of that position?
Pia mambo ya kiosks ya wafanyikazi. Kuna sheria pale kwetu ambayo inasema mfanyikazi wetu ama mfanyikazi wa shirika yoyote ya maji haruhusiwi kufanya biashara ya maji, because that amounts to conflict of interest. And if you have any case, because sometimes these members of staff can hide, we are not aware.
Pesa imetengwa 3 million euros, hiyo ni kama milioni 240, imewekwa 2 milioni kwa kushughulikia informal settlement. Kwa hivyo ndio tukweli na hiyo mikakati inaendelea kwa hayo tutamuita na
The Citizens Report Card also stimulated more formalized ties within civil society. Civil society organizations felt this would enable them to work collectively and hold the sector providers to account.
One of the impacts that came out from the CRC Citizen Report Card is that we needed to have some kind of strong network of the CSOs to be able to address the governance issues and the various challenges that exist in the water sector. So out of that came what we now call the Kenya Water and Sanitation CSO Network.
KEWASNET is an umbrella network of civil society organizations. The network has a website and an active listserv for members, and an electronic newsletter through which members keep in touch and stay informed. KEWASNET also initiated learning forums where member organizations are able to ask questions and engage in open and frank dialogue with experts and policymakers.
We have a crisis in Kenya because we have, before the water sector reforms and after the water sector reforms, we have water shortages. We have not quite defined what is water shortage. Is it a shortage of governance, a shortage of planning, a shortage of distribution, or inadequate budget allocations to the Ministry of Water?
Well, my question is, how serious are these men protecting water catchments?
Yeah, very sure we are very serious, and I want to tell you in one thing, in that the water catchment, conservation lies in a various number of sectors. We know we had done wrong things in the past, and that is what we are reaping today. But you don't commit suicide or die or leave Kenya because of your past deeds. So long as you have realized and you are capable to change them, you go by that and change them, and let's have the good things. So we have in place good policies backed with political goodwill, which will be able to give us resources. and we have the technology and the manpower to do that.
As citizens and policymakers become more comfortable in engaging each other, the Water Services Regulatory Board, WASREB, began to institutionalize the process of getting feedback. In Mombasa, Kisumu and Nairobi, where the CRC was undertaken, and in an additional fourth town, Kakamega in Kenya, the regulator WASREB appointed local residents to partner with them in monitoring the quality of services and providing feedback on agreed service indicators.
The Water Services Regulatory Board has put a lot of energy into looking at how the consortia that were developed through the Citizens Report Card process can be transformed into water action groups that ensure consumer voice and better accountability in the water sector and in the sanitation sector.
As the regulator of the water sector in Kenya, it is our intention to build that very strong linkage between the provider and the consumer, and making sure that consumer understands why the regulator is there and the provider understands also why the regulator is there, because regulation is basically about consumer protection.